wonderful to have all of you here today. My name is Karen Hayes, and I'm the Executive Director of KADLEC Neurological Resource Center. If this is the first time you've ever attended an event put on by KADLEC Neurological Resource Center, please raise your hand. Wow. Lots of opportunity for you to become a member of KADLEC Neurological Resource Center. If you're a member, you can get our newsletter and you have access to our resource lending library materials. And also you'll get to hear about all the wonderful educational programs that we're doing like this one. We have a couple coming up. We have two coming up in November on Parkinson's, one November 1st and one November 12th. And then again, another MTHFR presentation on November 15th, and that's going to be put on by Dr. Neil Rawlins and Dr. Katie Carlson. So mark your calendars for those. Again, we would love to have you be a member, and our membership drive starts at the beginning of November, but there is a table set out in the lobby. It's $30 for an individual and $60 for a family. So please do consider supporting us in that way, because it helps us to bring these educational programs to our community. We have a couple of things happening here today. We have Charter here, and they're taping this presentation because there's such great interest in MTHFR and memory, and so it will be available. I believe it's going to be on YouTube, and also is Charter going to air it, Nick, as well? So it'll be aired on Channel 3, which is wonderful. So if you don't catch everything today and don't get it in your notes, you'll be able to see it again. And I have some really exciting news. Just this week, well actually yesterday, Ann Henriksen from Mally's gave me some great news. Mally's is going to sponsor our MTHFR presentations for the coming year, which is really awesome. Because as many of you know, Mally's is a great resource for the things that you need when you're dealing with MTHFR, and they're a great resource in our community. So it is my pleasure to introduce Ann Henriksen this afternoon. Please help me welcome her.
All right, well, I'll be here afterwards, and I'm going to be at most of the talks from here on out. I am an MTHFR mutant myself. All of our pharmacists in the pharmacy are very well versed in talking to people with MTHFR. It's a passion of mine, and we're just very happy to help out. And so any questions you have, I will be outside afterwards, and then also feel free to come to the pharmacy anytime that you want a more one-on-one conversation. Thank you.
My name's Neil Rawlins. I'm an OBGYN physician, and some of you are probably wondering about that. Why is he talking? Let me just give you kind of a brief history lesson. I won't get long-winded on it, but 9 years ago, my son came back from doing missionary work and got really, really sick, and nobody could figure it out. Went to docs, they'd say, "You're dying, we don't know why." In trying to sort out how to get him better, we discovered that we had this genetic defect. And the week they released Serafulin and Deplin for use, the week that they made the press release was the week I went searching for it on the internet. They released it on Tuesday. I was searching on Thursday and found it. So I've given a talk just generally about MTHFR for nearly 6 years now to the public, because I had so many patients that said, "Can you talk to my dad? Can you talk to my sister?" And I go, "I don't have time to see all these folks." And so I started giving these talks, and there's been a lot of new research on memory and how this interacts with memory. And so they said, "Gosh, can you talk a little bit more in detail about that?" So the general talk, I talk about all of the things that are related to MTHFR, but in this talk I wanted to specifically address some of the new research. But Basically, this is a genetic defect that, because of the Human Genome Project, where they identified the entire gene sequence in humans, because of that, it has revolutionized the way we can practice medicine. But it's new. And, you know, it's just starting to come out. The research is getting more and more. But with this new approach to medicine, basically what we're trying to do is identify the problem that occurred in the gene that makes my family predisposed to certain medical things, and then come up with a strategy that treats it where the problem occurred, rather than treating the symptoms 5 to 7 metabolic steps later. So that's the whole approach to this, which is much different than what we've done in medicine. So as of January of this year, there was one thing that was FDA reviewed for a Human Genome Project, and that was this. And it's been out about 6 years. They released 2 more recently, but they're for a very, very limited part of the population. This is, all right. It's, my microphone's gonna drift on me, I think. So, but this is one that affects really a very, very large part of the population. So I said, okay, I feel like that I was given this information to help my son live, and I felt like I needed to share it with as many people as I can. I get calls from, just got one from Florida yesterday and New York. It's like, don't go out there. I don't know anybody doing this. But so anyway, that's the story. Probably took too long on that. I'm not selling anything. This is not a sales pitch. I do this just because I want to get the information out. This is new enough research, not all of the docs know it. I mean, it's pretty new, but the research is pretty impressive, and I'm going to go over some of that today, specifically on the brain issue.
How is your son doing?
He's doing very well. Yeah, he didn't die on me, which I was grateful for. But he will tell you, had we not discovered this, he would have. So memory loss is very, very common, and some studies show that somewhere in the neighborhood of 50 to 80% of people by the time they reach age 80 meet some of the criteria for memory loss. Some worse than others. And this genetic problem, MTHFR, is associated with causing it, or with the symptoms. Now, we don't know all of the causes, and this is not, there's much more information to learn. But what we do have is some things that work really well. So if you look at the observation data on what causes memory loss, or what's associated with memory loss, the first thing is homocysteine. People with elevated homocysteine levels have low level, or have more memory problems than people with normal ones. Elevated or low B12 is also associated with it, low glutathione, low methylfolate, and low acetylcholine. Well, it turns out every one of these is related to this, your body's ability to make the MTHFR, the methylfolate. So people with the methylfolate, if you look at the people that have dementia, just in one of the gene defects in MTHFR, the 677. So this doesn't take into account the 1298 or the others ones. More than 2/3 of the patients with this vascular, or with this gene defect, had dementia, and it was much higher than what the general population is. So this was one of the studies that they initially did to say, okay, should we try and come up with a strategy to treat it? So they looked at, and this is from the Framingham study, so this study's been going on for 40 years. They were looking at homocysteine, and what they noticed was people with high homocysteine levels had a much higher incidence of dementia, and people with lower ones had a lower incidence. So homocysteine is a very important piece of this puzzle. Well, the way you can lower homocysteine is to take methylfolate. So the reason it raises in the bloodstream with this gene defect is that this is in the pathway that allows you to convert homocysteine to methionine and onto SAMe. So you essentially have a blockage in that pathway, and it builds up. And that is associated with memory loss. Well, another one is that folate and B12. People with normal folate and normal B12 had much higher, so the way this graph looks is that this is normal right here. And here is decreased risk. So if you had normal B12 and high folic acid, the methylfolate, your risk of developing cognitive impairment, memory problems, is half of that of the normal population. Whereas if it was low, then it was increased as much as 5 times. So that's one of the things that says B12 is important, along with the methylfolate. This is another study where they looked at just the methylfolate itself. And people with high methylfolate had scored much higher on the memory test. So some of these tests are low is good and some of it's high is good, and I realize I'm putting out a lot of data and I don't expect you to necessarily remember all of the data, but I wanted to help you understand that there's some real science behind this, that if we can get people's methylfolate levels up, that showed a much higher ability to pass the test when they gave them the test to see how good their memory was. So the Alzheimer's.org has 10 questions that use, okay, do I have a memory problem? Is it a bad enough memory problem that I ought to do something about it? And these are the questions. You can get them at alz.org. So that's where the questions are if you want to look at it. But things like that the memory loss disrupts your life. My mother is 89. She goes through, she tells us all these things and then says, my memory's so bad. And it's like, Mom, your memory's better than mine is. But she's so worried about her memory. But so that's the reference that I wanted to just give you as far as where to look at this. And if you wanted, sometimes the hard part is we see everybody else that needs this. And sometimes we have a hard time seeing it in ourselves. So that kind of helps in saying, well, maybe I do need some of this. So what do you need? Well, we've known for a lot of years that if you have a good diet, that helps with preventing memory loss, exercise, keeping your brain active, doing, using your brain, doing word games and things where your math, that kind of thing, helps with it. But what they discovered was you still, in many respects, still lost your ability to or still lost brain cells when they did the studies on that. So the question is then, what can we do about it? And this was interesting because when they started coming out with treatments, a lot of it was just empirical, and then they did the studies and showed, now we know why it works. So if you have elevated homocysteine levels, then the methylfolate, the active form of folic acid, helps, and it helps a lot. But in the one study I showed with that, if you don't have enough B12, then it doesn't help near as much. And so the things that help with the homocysteine is the methylfolate and the methyl B12. Well, the things that help with the low levels of B12 are giving the active dose, but B12 doesn't absorb very well. And so if you can get it in an oral dissolving tablet, and in some cases I'll even use the B12 shots, that will help boost your B12 levels. But if we can get it in the active form, rather than most of your B12 supplements are not the active form, they're the inactive form, and they have to be activated. And it turns out that I've got both genes defective on MTHFR, I've got both genes defective on the next step, and both genes defective on the one that activates B12. So for me, it's critical that I have the methyl B12, not the regular B12, because I don't activate it very well. So the low glutathione, well, what glutathione is it's if you read about it on Wikipedia, it's an antioxidant. Well, it's 3 amino acids, and those 3 amino acids do several things. The antioxidants, so they block the oxidation stress that occurs in your brain. They also help you clear environmental toxins, so that, and we know that things like mercury and lead can cause problems. We've known for years that it causes the mercury's associated with depression. That's what made the Mad Hatter mad, is that they used mercury to make hats, and they all went nuts. And then one of the other things that glutathione does is it helps with your body's normal okay, I need more of that. No, what it does is it helps with your body's ability for the cells to function properly. So those are the 3 reasons why what they did was they just saw the association of low glutathione, poor memory, and that's how they came up with this strategy to treat it. But once they understood why, then it was an aha moment. Oh, now we know why what we've done worked. And so, and then the low methylfolate, some people can't activate the folic acid. 30% of the population of the United States have both genes defective, which means that their ability to activate folic acid is somewhere in the neighborhood of 10 to 15%. Another 40% have one gene defective, and they function on about 60% of normal. And then there's the normal, but then we've got a number of environmental things that block this same pathway. So you may have normal genes, but still have a difficult time with making the methylfolate because of environmental concerns. So the other thing is that they noticed that people that didn't make this a neurotransmitter, this connection between nerves, this chemical that sends messages between nerves, had trouble with memory. And so one of the things that is critical is this methylfolate is needed, and the methyl B12 is needed to make this acetylcholine. So those are the 5 things that over the years have been associated with low memory. And so they came up with, well, what can we do to make it work? How does it work? Well, they put together a pill, and this is the one that got FDA approved almost 6 years ago, to help with memory, or FDA reviewed. Because it's all vitamins and nutritional things, they didn't actually get approved, they got reviewed, but it's the same process of reviewing the data and say, does this work? And what they did was they put in the active form of folic acid, they put in the active form of B12, and then they put this amino acid that's one of the 3 amino acids to make glutathione that seems to be the rate limiting step. And putting that together really made a difference, and they showed tremendous benefit. Well, so when they looked at age-related memory loss, people would lose a lot of brain cells. They would just die. Well, this is what one of the studies that came out, and this was back in 2001, so this is 11 years ago when this study came out. It showed that if people got this, just the amino acid, not the other 2 things, this was the cell loss, almost 0, but in the control group, this was the cell loss. They were losing 35% of the brain cells. And so that's when they started saying, okay, let's see if we can nutritionally support this and get people feeling better. So then they did the study with the serapholin, those 3 things, the methylfolate, the methyl B12, and the N-acetylcysteine. And they put those together in a pill and looked at, okay, so, and this was over 2 years. This is the group, they looked at the brain volume and how much brain cell loss they had. And actually the way they did this is they did an MRI and were able to calculate the volume of the brain on an MRI. And then 2 years later, they did the same calculation and subtracted it and said, all right, how much brain cell loss has there been? And then they overlaid those images. And when they overlaid the images, what they did was they subtracted out, and the red shows how much brain loss they had. So this is the serapholin group, and there's a couple of little red spots there that are hard to see. They essentially had very little to no brain cell volume loss, whereas look at the one in the placebo group over 2 years. So if we can nutritionally support the brain so that we don't lose brain cells, then we can delay or even prevent. Now, we don't have enough data to say, does this over 20 years, because it's only been out 5.5, we don't know if over 20 years it's going to translate into cutting the risk of dementia long term, but it sure looks promising. This is the data that I said, okay, it's probably worth giving a talk just on memory alone. So this was, they had 168 participants over a 2-year period, and that's how much protection taking just those 3 nutritional supplements made. So what they said was, you know, once people get really bad, we don't know how well it works. Now they are starting to study that, but what we do know is if we can catch people before they have any symptoms, or while they're still having the early symptoms, we can make a huge difference on their ability to function, ability to think, ability to remember things. It's still important to do the nutrition. It's still important to use your brain and to, you know, not just sit in front of the TV and, you know, to do games, the other things that help our social interaction. People that are socially withdrawn tend to have a lot more problems with their memory than if they're interacting with people. So this is not you take this and you don't have to do any of the other things. But nutritionally, this is a huge support for being able to maintain your memory through the years. And what we're seeing is that the cognitive impairment, the memory problems, are showing up earlier and earlier. Partly because nutritionally, you know, I have a bunch of kids, and as teenagers, they didn't do very well at nutritional. You know, they liked things that weren't necessarily what we consider great nutrition. And as we progress on through our life, those things start to catch up to us. So what about this? You know, if I take these 3 nutritional supplements, the 2 vitamins and the amino acid, is it going to interact with my other medications? Well, interestingly, this is one, am I going to get toxic? Well, all of these things are water soluble. So if you get too much, you just pee it off, which may make it expensive urine, but I'd rather have that than the memory loss. What they did notice that is in high doses in people who were on some anti-seizure medications, it made the seizure medications not quite as effective. What it did was it made them clear the seizure medications, things like phenytoin and phenobarbital, those kinds of things. So if you're on those, that would be one precaution. They haven't noticed the same effect on the new anti-seizure medicines, the gabapentin, the pregabalin. And there's no interference with the anti-Parkinson drugs. So that was the other concern, is it going to make what we're already doing worse? And it doesn't seem to. And interestingly enough, they did the one that's available for depression, they compared it to placebo, and the placebo had a lot more side effects. Because when you're depressed, you got a lot of side effects. You don't feel very good. And the people that took the vitamin felt so much better, they didn't complain about much because they felt better. And this is similar in that very few people complained of side effects, and compared to placebo, they did about the same. They didn't stop at any more than the placebo people did. Sometimes when you're first starting it, you can get a little bit of stomach upset, especially if you take it on an empty stomach. And then the other thing is that some people would get a headache, but it's very rare for that to persist. And I think that's due to you notice the pill was blue. They have a dye in there, and some people are very sensitive to the dyes. And what I've found in the ones that have had the headaches, it's mostly once we can get on some ones without the dye, then they do fine. Now, so how do you get methylfolate? Well, of course, we've got the serapholin, and that helps with memory. It's got the methylfolate, the B12, I didn't put that in there, and the N-acetylcysteine. There are other forms of getting this. One, you can get Deplin, which is just the methylfolate. Meta-Nex is FDA reviewed to help with nerve pain. And so they use it in diabetic nerve pain. It helps with any kind of nerve pain. I use it. It also helps with wound healing in diabetics. Then It's also in some prenatal vitamins. There's 6 of them out there last I counted that had this active form in it. And then you can get it over the counter. So Cerefolin you need a prescription for, but it turns out you can get all of these things over the counter. Anne has been kind enough in my craziness over the last few years to, if I want people to try any of this, she stocks it in her pharmacy, because you can't go to most of the pharmacies in the Tri-Cities and get methylfolate. You have to get it, well, the only pharmacy that I know carries it now is Mally's. And it's called MTHF, and you go talk to the pharmacy folks and they know all about my crazy stuff. So B12. B12 is, again, a complex absorption pattern, and you really want to, as much as you can, get it in its active form, because there's not an easy way to test for the gene that says you don't activate B12. So let's just get it in the active form and do it that way. And that you can do as an oral dissolving tablet. Now, in some people, we do use it, especially fibromyalgia. I'll use it as a shot, but usually try the oral dissolving tablet first, because that seems to work for probably 95%. And it's very temperature sensitive, especially the shots. You have to not get it too hot or it degrades. And then the N-acetylcysteine. Go to any of the health food stores, they have this amino acid, and that's all it is. It's cysteine, but the N-acetyl form seems to absorb better. So they call it the NAC, and that helps you clear the heavy metals, it helps with memory, and it helps all of your cell functions work better. If you look at a biochemistry chart of where glutathione works, it's everywhere in the cell. So, questions? Does that make sense? Yeah. Okay, the question is B12 levels, and my B12 level is fine, but the one they're testing for is the inactive form of it. So my folate levels are fine, but I still take the methyl B12 because I've got to get the activated form, because I don't activate it. Now, I'd love to have testing that I could just test and find out everywhere there's a blockage, but until I get that, we have to just try it. What we do know is if you just take folic acid and don't take B12, you sometimes can end up with an anemia problem. That's only been shown to be the case with the regular folic acid that you get at the store. It's not been shown to be the case at the with the active form of folic acid, but I still worry about it. So I would still take the B12 because it doesn't absorb real well. And then you'll still have some of the active form, though, if you have that blockage in the methionine synthase reductase, if you want to know what the enzyme name is. There will be a test on the enzyme names at the end. Yeah, yes? There are studies that they're looking at Parkinson's. Interestingly enough, some of the studies a few years ago, they were looking at Parkinson's disease, and they took people with really bad Parkinson's disease and gave them IV glutathione, and the symptoms went away for 3 days. And then they'd come right back. But if we can boost the glutathione, at least in Parkinson's disease, that seems to help. We don't have enough studies to say how much it'll help or whether or not we can reverse it completely. So the genetic testing for MTHFR is readily available, and the reason from any lab, the reason it is it's in the evaluation for blood clots. It's also in the evaluation for recurrent miscarriage and stillbirth and those kinds of things. So it's a readily available test. And when I first started doing this 5 years ago, I tested everybody. I figured, I can figure this out. Well, it only tests for 2 of the common defects of MTHFR. So there's now recognized over 50 of them. So it does test for the 2 common, but even if you don't have a recognized gene defect, it's worth trying. And so the test is somewhere around $230 to $300. And what I've found is insurance covers it about 70% of the time. What I tell people is if you're willing to try this stuff, try it. The best reason I can think of for doing the testing is so you can convince your sister and your brother and your kids. And you know, when I first got my testing done, I came home, I sat down, my 17-year-old son was reading his book at the table, and I said, Wesley, I want you to know I'm defective. And he looks up and he goes, well, yeah. I said, but the sad part is this means you're defective too. He says, you don't know that. And I said, actually, I do, because I got both genes defective. Your mother's got both genes defective. I can guarantee you do. So the testing is pretty easy to get. It's called MTHFR because most people have trouble with MethylTetraHydroFolate reductase. So I don't know why, but and you can get the test. I wish I could. The diagnosis I use is metabolic disturbance, which is the ICD-9 number is 270.4, but that's how I order the test. It's a simple blood test, that's it. Well, if somebody has the shrinkage already, is that going to help is the question. And what we seem to do is if you're shrinking, if you can then nutritionally stop that, you can maybe stabilize it. I don't know how much we can regain. That's still a question. So, and typically one of the things we've tried is over the years is SAMe, and we noticed that it helped some things and made other things a little worse. We now know why, because of this genetics, that if you can give the methylfolate, it helps all of these pathways. If you give the SAMe, it only helps one of the pathways and may actually even block the other pathways. So if you can get, the closer you can nutritionally treat to where the problem occurred, the more likely you are to be able to treat all of the symptoms rather than just a limited amount. So that's why I go this route. But it really remains to be seen whether or not, how much we can gain. So part of the reason why I give these talks is to get this information out there so that people can do the prevention, and because we really don't know how well it works on treatment. Although there's a study January of 2010 in primary psychiatry that showed that it does help improve at least some patients with Alzheimer's. So we knew it helped a lot with age-related memory loss. It does seem to help with people who already have Alzheimer's. So it's certainly worth a try. Well, there is a generic form of Deplin. There's been a number of generics because it's worked so well and popular. Some of them have come out of China and their stability has been horrible. So the people that tried it, they said, not only does it not work as well, but Deplin has come out with their own generic. And so more insurances are covering it. I think the patent's got another 5 years on it. But you can get it over the counter. The cheapest way I've found is if you can get your insurance to cover it is on prescription, but you can get the over the counter. And taking some is better than taking none at all. So if you go, gosh, I can't afford all of it, or the high dose, you can get the over-the-counter doses, and it's a lower dose, but it's better than not taking it at all. Yes. Nobody knows yet. I wish.
Are there some cautions? Considered?
Again, so over the counter, you can get 0.4, 0.8, 1 milligram, and 5 milligram. Mally's carries the 1 milligram and the 5 milligrams, and they're actually less expensive than the 0.4 and the 0.8 when I've checked the price on them. Nobody knows what the optimal dose is, partly because it depends on whether or not you've got this gene defect, whether or not you've got both genes, whether or not you have which subtype you have, and how much environmental damage or environmental toxins you're exposed to. So it really is, until we get different testing, it's a trial and error. Okay, sorry, the question was, does Medicare cover this? And it depends on which plan you have. Over the last 5 years, there has been more coverage, I've noticed, that people have. So, okay, so the first question was, what is the relationship of this to chelation, right? Well, as I mentioned, if you've got this gene defect, you don't clear environmental toxins well. And so people who have environmental toxins build up do benefit from it. But if you can also correct the metabolic problem, then you can decrease your likelihood that you're going to need chelation in the future. Okay? So I think chelation therapy helps, but it's a stopgap measure. It's not correcting the problem. And your second question, well, regarding the homocysteine levels and whether or not that is needed for statin drugs for elevated cholesterol. The Framingham study, this study that's been going on 40 some odd years, what they looked at was the homocysteine levels and really how much they affected things like high blood pressure, stroke, and also some related to the cholesterol. If we can lower the homocysteine levels, you can improve your risks of those things. But the other thing that I've found is lowering the homocysteine levels also tends to lower your cholesterol. When I started taking methylfolate, it lowered my cholesterol 60 points, just with the methylfolate. So we don't know why, first of all, that they go up, but this does seem to help correct some of the problem in making it better. Does that help? Well, one of the things that happens with stressful time, so the question is, okay, you're going through a stressful time and things get worse, your memory gets worse, those kinds of things. Stressful times use up more methylfolate. So when you have an illness, you're using up a lot more methylfolate than when you're not. So usually what I tell people is if they're having a surgery or a stressful event, to bump up their methylfolate. It also helps shut off viruses, so when you're sick, your body uses up a lot of the methylfolate that's circulating. So if you can then add it, you can get over your cold faster and that kind of thing. So the question is, okay, during some stressful event, can you go up? So if you're on the over-the-counter 5 milligram, you can absorb somewhere between 12, 13 milligrams at any one time. So what I'll tell people is when they're having a lot of trouble, to take 10 milligrams or 7.5, depending on whether or not they're using the prescription or the over-the-counter, and do that every couple of hours in the morning because it gives you energy. You don't want to be taking them at night when you're trying to go to sleep. That's not a good idea. But if you can get the methylfolate levels up, you're going to be able, your body's going to be able to handle the stressful events better, and you'll heal faster if you've had, surgery or an injury than if you just stay on a constant dose. And now in psychiatry, they are using as much as 45 milligrams a day in 3 doses. So they'll do 15, 15, and 15. Now, if I do that, I usually have them do morning, 10 o'clock, and noon, because it gives you 8 hours of energy. And otherwise, then you have to give them something to sleep at night. And I don't like running with the gas and the brake on at the same time. I don't want to give them something to give them energy and then give them something to sleep. So the risk to that is that you're going to have expensive urine. That's it. It's water soluble, it clears, and as long as you don't have, kidney shutdown for some other reason, it should clear without any problems whatsoever. Okay, so the question is, why are psychiatrists using that high of a dose? What are they using it for? They're using that for severe depression. They're using it for schizophrenia, bipolar, in people who are not well controlled. And what I've found is that if I add the methyl B12 and the N-acetylcysteine and sometimes the active form of B6, I rarely have had to go more than 15 milligrams. I have had people that have had an acute stressful event that I've gone up to 30 and used that. But they really, even at 45 milligrams, have not noticed any side effects. I would rather treat some of the other things along the pathway rather than just bump up one nutritional supplement and kind of ignore the others. So that's my approach, but I mentioned it just because the question is how much is too much, and it doesn't seem to be a big problem other than the cost. So the question is, are they using this for post-traumatic stress disorder? What it does do is help with healing. It helps with nerve healing. So it should work. I did speak with a psychologist that is working with that, and he was going to submit a grant and try and get funding to treat post-traumatic stress disorder in the military with it. Haven't heard back if he was able to get that funding, but it should work, and it's certainly not going to hurt them. The question is, if you've got a strong family history of Alzheimer's, what tests should you get? There's not really a set number of tests. There are some new genetic things they have associated with Alzheimer's, but they're not commercially available. Your doctor's not going to be able to just order that test. MTHFR was available because it was associated with blood clots. That's why they had it available. I don't order it for blood clots as much anymore, but the ones for Alzheimer's are not what we call clinically available. They're not something I can just write on the lab and send it out. You have to do some sort of research study to get those tests done. Okay, so the other question is, does this stuff help with obsessive compulsive? And that's in my other talk, but what happens is that this is the pathway that makes your acetylcholine it makes your serotonin, it makes your norepinephrine, and it makes your dopamine. And the area in the brain that is what we call the gear shifter, the one that allows you to shift, is serotonin mediated. So if you don't make serotonin well, you don't shift gears well. And so that you tend to be obsessive about things and have a lot of compulsive things. So people with this disorder, with this genetic defect, tend to have more, they tend to be more obsessive and they tend to be more compulsive, to the point that sometimes it becomes a pretty significant problem in their life. You know, being a little obsessive enough that you turn your homework in means you'll graduate from college. So almost all college graduates have this gene defect because they were compulsive enough to turn in their homework. And then, of course, where do they find somebody to marry? At college. And so sometimes, you know, it's not that it's all bad, but if they do have obsessive compulsive disorder where it's disrupting their life, it is worth trying this because it does help. It boosts your ability to make serotonin, which is what regulates that part of your brain that allows you to shift gears. And you know what? When guys come see me, it drives the insurance companies nuts. It's like, he's a gynecologist. Didn't you know that he was a gynecologist? What are you seeing Dr. Rawlins for? The Neurologic Resource Center keeps a list of providers that like my crazy vitamin stuff and are willing to do it. Right, and there's a new family practice doc in town that she did her senior project on this. So she's very much on board with me on this. Yes. So the question is on birth defects. Well, it turns out if you're defective, you have a higher chance of having a baby with Down syndrome, spina bifida, heart disease, all of that. So Down syndrome is that when the cell splits, the chromosomes get messed up. Methylfolate is critical in that process. And so if you take the methylfolate and the mother or the father has MTHFR, you will reduce the risk of Down syndrome, you'll reduce the risk of the spine not closing. Article came out last year that, because I've been arguing with the state of Washington that they ought to cover this for the Medicaid patients, and they said if we could get all women to take methylfolate rather than just folic acid, we could probably cut the risk of congenital heart disease in half. So I still keep fighting with the state, and one of these days they may listen to me, and you know, I'm not holding my breath, however. Yes, that's a good question. So the question is, are these supplements used instead of antidepressants? When they went through the FDA, the fastest way to get it through the FDA is to use it as an adjunct to antidepressants. And it turns out that it takes about 3 to 4 months for your serotonin levels to build back up. Getting off on depression, we've known for many, many years is associated with low levels of serotonin, dopamine, and norepinephrine. The antidepressants don't raise your levels up, they just make your low levels hang around longer, work longer. This actually raises the levels up. So I have for 5 years used it as a primary treatment for depression, especially in women that are postpartum depression, because we don't like to use the antidepressants if they're breastfeeding, and it works really, really well. They actually are now doing the studies so that we can officially say that you can use it as a primary treatment for mild depression. In somebody who's severely depressed, it tends to be slow enough onset. Although if you ask people, most of the time within a week they're feeling better because it gives them energy and it helps with their ability to cognate, to think, which are two of the things that they struggle with depression. And so I will give people a trial and I say, look, if in 2 weeks you're not better, we will go. And I've had very few that I've had to add an antidepressant. So officially, yeah, depending on how severe they are, I may go to a week and say, look, I don't dare risk it longer than that. But I've had some great success with using it as the primary treatment. And they are studying it now. Just took a long time to, they wanted to get it out there, which I was very grateful for. We've seen a lot of improvement. It's certainly worth a try because the risk is expensive urine. That's it. Okay, so I'm happy to answer some other questions, but you've been very patient to put up with me. So the question is, do you space them? Space if you're taking a multivitamin away from you when you're taking the other. Nobody studied that. Potentially there's a problem with that, but with taking them at the same time, there's some risk that it may interfere with the absorption. The problem is then if you forget to take it other times, you're not taking it at all. So that's the balance. Do you take them all at once or do you space them out? They probably absorb a little better if you space them out, but not if you don't. If you forget to take them, they don't do much good. So the question is, what's a good multivitamin? Look for ones that they have actually tested the absorption on. That's one of the keys. If they actually have absorption studies, then they actually have tested it. A lot of the vitamins, they just throw it in the pill, but it doesn't dissolve. They don't. Okay? You're welcome.